Hello and welcome to this presentation on vagus nerve stimulation, which is a therapy that may have relevance to a wide range of chronic conditions. Vagus nerve stimulation may improve the functioning of the autonomic nervous system, and this is a system that controls the functioning of our internal organs, but it also influences our brain function and our immune system. Autonomic nervous system dysfunction may be present in a wide range of chronic conditions, including physical, psychiatric, and neurological. And this dysfunction may present an opportunity for improving the symptoms of a wide range of conditions by specifically targeting the autonomic nervous system with therapies that may improve its functioning. Autonomic nervous system dysfunction is also appears to be present in the condition that I personally live with, which is myalgic encephalomyelitis, also known as chronic fatigue syndrome, or ME/CFS for short. And this is a condition that has no approved treatment. However, I have experienced improvement in my symptoms through using therapies that may improve the functioning of the autonomic nervous system. So when I found out about vagus nerve stimulation, it seemed like a logical thing for me to try. So I purchased a transcutaneous vagus nerve stimulation device called the Parasym, and I was really pleased to see very rapid and significant improvement with the use of this therapy. And I shared my experience with friends who also have ME/CFS, and they decided to purchase their own devices at their own cost and own risk, on the understanding that this is highly experimental because there is no published research yet on the use of this therapy for this condition. And if you're interested in, more detail about my experience and also on some data that I collected from them on their experience, then I'd encourage you to check out my more detailed presentation on YouTube, which is called What Happens in Vagus. And in that presentation, I also go a bit deeper into the research and the hypotheses that I drew on to, develop my own hypotheses about the potential benefits of this therapy for ME/CFS. As with any change in therapy, if you're considering this therapy yourself, I would encourage you to have a chat with your doctor first. So for now, let's start looking at what the autonomic nervous system is and how it may affect our health. So what is the autonomic nervous system? Well, it's essentially our automatic nervous system, and it controls the functioning of our internal organs. And as you can see here, we've got two divisions, the parasympathetic system and the sympathetic system. And the vagus nerve is the primary nerve of the parasympathetic system. So in the traditional view of the autonomic nervous system, it's viewed as being two systems of sympathetic fight or flight and parasympathetic rest and digest, because of the way that these different systems affect our organs. However, according to polyvagal theory by Stephen Porges, the autonomic nervous system actually has three circuits, not two, and that's because the vagus has two branches, the ventral and the dorsal. And these three modes basically function in situations where we are in safety or danger or life threat. So in situations of safety, the ventral vagus parasympathetic is active, and that's our rest and digest system, but it's also our tend and befriend system. So this is our social engagement system, and this enables us to have naturally occurring friendly social behaviours, like having facial expressions and smiling and having intonation in our voice. Then if we're in situations of danger, the sympathetic fight-flight system kicks in, which is our mobilisation system. Please bear in mind, this isn't a bad system. We use this circuitry to engage in physical activities, so this is something that's part of normal life. However, when it's extreme, then we go into this fight and flight mode. And then the third circuit is operating in situations of life threat, and that is the dorsal vagus parasympathetic, and this leads to freezing or fainting. So it's an immobilization mode. So autonomic nervous system state essentially affects everything. And on this chart here, which is being created by Babette Rothschild, and it relates to the treatment of trauma, you can see these 3 zones here. And she provides details as to how this affects the functioning of all of our internal organs and our circulation and also our brain function. And she's also included some transitional states in between the green, orange and red. And feel free to Google that if you want a bit more information, but essentially normal life should be in this green to blue zone here. But we notice in many chronic diseases, the balance of the autonomic nervous system has actually shifted more to the right. So bearing in mind that autonomic nervous system state affects everything, many of the symptoms that we observe in chronic diseases may actually be related directly to the dysfunction in the autonomic nervous system. So how can we actually tell if there's poor functioning of the green zone? Well, we can measure this, and we can use something called heart rate variability, which is different to heart rate, and this tells us how well the green zone is functioning. And I did some Googling of various chronic diseases and found that low heart rate variability may be present in a range of chronic diseases. The good news is that vagus nerve stimulation may activate the green zone. And it's actually an approved treatment for these conditions. And in addition, it's being investigated in many other conditions, as you can see in this list here. So for these conditions, I was able to find at least one published study showing improvement in symptoms. The strength of the evidence varies, and we're certainly not at a point where we can make any claims about vagus nerve stimulation being an approved treatment for these conditions. However, it is under investigation. So what is vagus nerve stimulation? Well, it began as an implanted device, much like a pacemaker, and was initially used for epilepsy and then was approved for use with depression, and then it's really expanded from there in the range of conditions that it's being investigated in. And fortunately now we have transcutaneous options, so that means there's no surgery required, and it's basically applied with the use of a device on the skin at branches where the vagus nerve comes out. So these are some transcutaneous vagus nerve stimulation devices that I found on Google, and the Parasym is the only device that I'm aware of that is available in Australia, and it's indicated for the use of treatment of depression, anxiety, insomnia and tinnitus. And you don't require a prescription for this device. You just basically do an online medical assessment with Parasym. However, I think it's a good idea to have a chat with your doctor about this if you are considering this treatment. In terms of what vagus nerve stimulation may do, it may do many things, including reduce inflammation, reduce anxiety, improve mood, and also improve pain regulation. It may alter concentrations of neurotransmitters in the brain, including serotonin. There is preliminary evidence that it may reduce gut permeability, also known as leaky gut. And it also may promote neuroplasticity, and this is the brain's ability to make structural and functional changes. And if you've got a brain injury, this is what you want. You want neuroplastic healing. And as such, vagus nerve stimulation may improve rehabilitation outcomes when it's paired with therapy, like in stroke rehab. And vagus nerve stimulation may improve the functioning of the green zone overall. And if it does, then we should really see very, very broad effects. And this has certainly been my experience. As you can see from this list here, the improvements have been really very broad, and many of these improvements occurred, I guess, in real time, so during stimulation, and but then there was this ongoing accumulative effect, which may be due to changes in the autonomic nervous system from the therapy over time. So this therapy has been part of a broader treatment approach that I have taken to my ME/CFS, which has included other therapies that may improve the functioning of the green zone. And the overall effects from this approach has led to an improvement in my ME/CFS. I used to be severe, and now I'd put myself in the mild to moderate category. But it's also significantly improved a range of other chronic conditions that I have lived with in my life, including severe migraines. I hardly get any migraines at all now. Definitely has improved my anxiety and issues with low mood. I have the best mental health I've had in my life. And also I feel that it has dampened down some mild autistic traits that I have. I would even go as far as to say that I don't think I ever really knew what the green zone was until I started treating my ME/CFS. And these broad benefits that I've experienced from this therapeutic approach is certainly consistent with the hypothesis that chronic diseases may have some common underlying dysfunction that may be treatable with common therapies. So this is what the Parasym device looks like, and basically you just click it onto the left tragus, which is this little bit of cartilage here. I usually moisten the area first for good conduction, and if you put the cord behind your neck, it does tend to stay a little better, and I just use a peg as well to hold it in place. And then all you do is you increase the intensity very gradually until you can just feel a very slight tingle, and then you back it off so you can't feel it. And that is the basically the level that you need to have it at. And you need to set that each time that you use it. So as such, this device is really only suitable for people who can notice and monitor that level themselves, because the level is often different each time that you use it. Now this device is currently being sent out just with the firm ear clip, which does stay on better. However, if you have issues with pressure, you may find this painful, and for me, I can only tolerate the soft clips. So if you're considering ordering one of these and you are sensitive to pressure, then I'd encourage you to just mention that in your order that you would like a soft clip. It can also be requested after the point of sale from Parasym as well. So if you're interested in going a little deeper on this topic, I'd encourage you to check out my more detailed presentation on YouTube called What Happens in Vagus. And in this presentation, I explore the theories that I use to develop my hypothesis regarding the use of this therapy for ME/CFS. And I go into a bit more detail about the science of vagus nerve stimulation. At around the 28-minute mark, I explore my personal experience of this therapy and also the experience of others who have used this Parasym device. And if you're interested in my broader treatment approach to ME/CFS, which I call a systems theory approach, that is at around the 39-minute mark. And for more information on any of the devices I've discussed, please refer to their websites.